I'm Dr. Sayeda Rukshida. I'm a psychiatrist. I'm based in Mumbai, India. Today I wanted to talk about mental illnesses, especially in view of Covid-19 pandemic. We know mental illnesses, right? We've heard conditions like depression, we've heard anxiety disorders and panic attacks, and we've heard schizophrenia, we've heard bipolar mood disorders, we've heard obsessive compulsive disorders, we know dementias, childhood disorders, we know eating disorders. What are these disorders? They're medical conditions. And just like other medical conditions like blood pressure, hypertension, diabetes, thyroid or liver disorders, psychiatric disorders are also medical conditions which happen to people with a predisposing genetic vulnerability. The genetic vulnerability could be an inherited one. It's just like if my father has diabetes or my mother has hypertension, there are higher chances of me having those disorders. Or they could be just my disorders. Maybe my parents are very healthy and I still might have a thyroid disorder or a liver disorder. But with the COVID pandemic, with the coronavirus infection, there is an increase in risk of psychiatric disorders because psychiatric disorders have a connection with your autoimmune system, with how your body responds to an infection, with how a body gets impacted because of an infection, the inflammation process, and even the medications that we need to take for them. So these are medical conditions that are intertwined. So people who already have a psychiatric illness are especially vulnerable to acquiring the virus itself and getting infected because of the virus. And the people who have a predisposing medical condition, whether it's hypertension or diabetes or a psychiatric condition, the treatments get a little complicated. People who may not have had a previous psychiatric illness are more vulnerable to now acquiring a psychiatric illness because they were also infected with the coronavirus. Again, it's because medical illnesses and psychiatric illnesses are intertwined. One system is going to impact another. What are the symptoms of a psychiatric illness? Any disturbance in behavior, any disturbance in sleeping patterns, disturbance in eating patterns, emotional swings, mood swings, emotional dysregulation. There could be thought disorders. There could be difficulties in thought process. Somebody could have hallucinations, others could have delusions. Because psychiatric illness, they impact our emotions, thoughts, our everyday lifestyles. They also impact our cognition. We could feel a little less sharper. We could feel that we are finding difficulty with concentration or attention span. We don't seem to be learning as easily as we used to. These are all symptoms of psychiatric illnesses. So if you have an infection, if you've had an infection of coronavirus, or somebody that you know who's had an infection of coronavirus, they will require some time to recuperate and recover from that illness. And during this time, if you notice within yourself or within somebody that you know psychiatric symptoms, you must speak to your doctor, you must consult a psychiatrist. People who already have psychiatric illnesses must also get in touch with their psychiatrist because this makes them more vulnerable of getting the virus and, like I said, with a complicated history of treatment. The other aspect that we need to worry about is because of the fear. When we are all worried about the infection and the stress levels have increased because of, especially in India when we have the lockdown, worry, fear and stress also increases our vulnerability of having psychiatric illnesses. We need to understand there is a difference between mental health issues and mental health disorders. Everybody has to practice daily healthy routines that are going to be very important for our mental health. Some of us are going to have mental health issues. They may be temporary, they may be mild, and they may be manageable. But those of us who do have a mental illness, who have a psychiatric disorder, they definitely need to get it diagnosed accurately by a psychiatrist, and they have to work with the psychiatrist to plan their treatment, which may include medications and or therapy. Medications are safe. They are required for you to be you. They are not habit forming. there is a lot of misinformation as far as psychiatric medications are concerned. Please ask your doctor, ask a psychiatrist. Take a second opinion if you need to or if you want to. But if you take care of your mental health, you're definitely going to have a better physical health. We always say there's no health without mental health. And at the same time, you need to also be aware that we are still in the pandemic. So stay home and stay safe.